Welcome back. Let's talk about who the stakeholders are in global health and how this relates to global health diplomacy. One of the things I find so fascinating about this topic is that global health diplomacy involves so many stakeholders, including governments, multilateral organizations, philanthropies, and even celebrities. For this lesson, I'm going to give a high-level overview of the types of organizations and the role each plays. We'll go into more depth on each type in the later sessions. The first category is government, which we can break into developing countries and donor countries. Let's look at Kenya as a case study of global health diplomacy in a developing country. Kenya has a population of nearly 40 million people, more than half of whom live in rural areas. Since the country became independent in 1963, through the late 1980s, Kenya had more than quadrupled the number of health facilities serving its growing population, extended life expectancy from 40 to 62 years, and improved child survival rates. However, an economic downturn in the 1980s and the intensification of the HIV/AIDS pandemic in the 1990s exacerbated a number of health challenges for Kenya. Beyond grappling with a persistent high burden of infectious diseases, including malaria, HIV/AIDS, and tuberculosis, Kenya faces an emerging chronic disease problem characterized by increasing rates of cardiovascular disease, cancers, and diabetes. Thus, since the 1990s, some of Kenya's early achievements in health have begun to reverse. As a result, Kenya has attracted significant international aid from many countries and multilaterals. The United States is the largest bilateral donor, channeling funds to Kenya through the President's Emergency Plan for AIDS Relief, or PEPFAR, the President's Malaria Initiative, and the U.S. Agency for International Development. The proliferation of donors in Kenya since the 1990s, coupled with the desire to avoid duplication of donor efforts, led the government and its development partners to formalize what's called a Kenya Health Sector-Wide Approach, abbreviated as a SWAP, in August of 2007. This non-binding document was signed by the United States, Denmark, the United Kingdom, Germany, Japan, and the European Union, as well as representatives of multilateral agencies. And it's designed to ensure all partners are working toward common goals. Now let's look at an example of global health from a donor country perspective. One of the largest bilateral donors for global health is the United Kingdom, and they have definitely used their leadership in global health as part of their diplomatic toolkit. The UK is the second largest aid donor in the world, as well as Europe's largest donor to global health. Britain was the first G7 country to meet the UN target of spending 0.7% of its gross national income on overseas development aid. The UK's Department for International Development is the department responsible for administering overseas aid. Its goal is to promote sustainable development and eliminate world poverty. The areas for action outlined in its global health strategy are global health security, responding to outbreaks and incidents of international concern and supporting the public health response to humanitarian disasters, public health capacity building, strengthening the approach to international aspects of health and well-being through non-communicable diseases, and strengthening UK partnerships for global health activity. In 2014, DFID's annual spend overall was £11.7 billion, approximately $16.6 billion, and they work in 27 countries. Two of their main global health priority areas are fighting malaria and improving reproductive, maternal, and newborn health. A second category of stakeholders is multilateral agencies, which are key to global health diplomacy. Let me first define what we mean by multilateral organizations. These are global organizations where multiple parties come together towards a common goal. So the United Nations overall is a multilateral organization and includes organizations like the World Health Organization and UNICEF. In a later lesson, we will talk about some other multilateral organizations, such as the Global Fund and the Global Alliance for Vaccines and Immunizations. For now, let's briefly look at UNICEF as an example. UNICEF was originally founded as the United Nations Children's Fund in the days following World War II. Their goal is to unite all relevant actors in the community, nationally, and around the world to help children and women live happy and healthy lives. Their strategic plan focuses on 7 outcomes, including health, HIV/AIDS, and nutrition. UNICEF works in 192 countries, and their mode of work varies. They can work towards specific goals in country or as the leader of coalitions that drive forward priorities. For example, they led the work for the Global Action Plan for the Prevention and Control of Pneumonia. Our next category of stakeholders is philanthropy. Philanthropic organizations play a major role in global health diplomacy, although it is often overlooked. If you go back 100 years, one of the first areas the Rockefeller Foundation focused on was public health. Today, we have a wide range of philanthropies working on global health who use diplomatic tactics to achieve their goals. The Carter Center, founded by President Jimmy Carter, is working to eradicate guinea worm, which involves significant partnership with the countries where the disease remains. The Children's Investment Fund Foundation worked with the UK government and other countries to host a summit on the importance of investing in nutrition. And the Bill and Melinda Gates Foundation uses global health diplomacy for all the issues they work on, including polio eradication and malaria eradication. Let's take a moment to pause and review what we've learned so far. A fourth group of stakeholders, who are also not usually included when you think about global health policy, is celebrities. The lead singer of U2, Bono, devotes a significant portion of his time using his global celebrity to open doors to world leaders to talk to them about debt relief, HIV/AIDS, or malaria. Other celebrities have used their influence to partner with world leaders to advance global health causes. Model Christy Turlington Burns started Every Mother Counts to focus on maternal health and safe childbirth. And actor Matt Damon works with Water.org to advocate for clean water in the developing world. I would be remiss if I didn't mention 2 other major categories of stakeholders who are the backbone of global health delivery, although less often involved in the diplomatic side of global health. Private sector companies provide the drugs, vaccines, and other critical commodities that support health. And it's important to recognize the important role non-governmental organizations play in executing programs. There are literally thousands of NGOs that are often the backbone of the healthcare system in many developing countries. Some of the big global ones are Save the Children and CARE, but there are many others out there. So in summary, there are many global health stakeholders, including governments, multilaterals, and philanthropies, and each plays an important role in global health diplomacy.